Hello, my name is Jalen Abraham. I'm a benefits counselor in the Central Benefits Office located on the Columbia campus. Today we're going to discuss benefits that are available to eligible employees. The University of South Carolina offers eligible employees a comprehensive benefits package through the state's Public Employee Benefit Authority program. In addition, we offer voluntary benefits to supplement state coverage. This is not a comprehensive overview of the benefits offered by USC and PEBA. For additional information, please refer to our website and available resources. Determining the right insurance benefits for you and your family is very important. Before you choose a plan, please visit PEBA's website at www.peba.sc.gov to learn more about the insurance programs and retirement plans offered at USC. If you are employed on the Columbia campus and have questions about enrollment or signing up for insurance, please call 803-777-6650 or email us at benefits@mailbox.sc.edu. Otherwise, please contact your campus Human Resources Office for assistance. The State Health Plan offers the Standard Plan and the Savings Plan to active employees. Eligible members of the military community may also enroll in the TRICARE Supplemental Plan. The State Health Plan is a self-funded insurance plan in which members and employers' premiums are held in a trust fund and used to pay claims. Blue Cross Blue Shield of South Carolina processes health claims, and Express Scripts processes prescription claims. The State Health Plan is an incredible value to South Carolina's public workforce. PEBA produces the annual 50-state survey and quarterly trends newsletter publications, which give you an insider's look into how the plan is performing. To learn more, please visit peba.sc.gov/facts webpage. Because the State Health Plan operates as a Preferred Provider Organization, or PPO, it has networks of physicians and hospitals, ambulatory surgical centers, and mammography testing centers. Through Blue Cross Blue Shield Global Core, your state health plan identification card gives you access to doctors and hospitals in more than 200 countries and territories worldwide and to a broad range of medical services. Network providers will file claims and accept the plan's allowed amount, even if its charges are higher. If you use an out-of-network provider, you may have to file claims and could be balance billed. You may pay a higher coinsurance as well. To find a network provider near you, simply use Find Care link under resources at statesc.southcarolinablues.com. There are 3 important terms which you should know. Annual deductible is the amount you pay for covered services before the health plan begins to pay. Coinsurance is the percentage of the cost of health care you pay after meeting your deductible. Co-payments are the fixed amount you pay for a covered health care service. The Standard Plan has higher premiums but at lower annual deductibles than the Savings Plan. When one family member meets their deductible, the Standard Plan will begin to pay benefits for them, even after the family deductible has not been met. The Standard Plan annual deductibles are $515 for individual coverage and $1,030 annually for family coverage. As a Savings Plan subscriber, you save money through lower premiums, and you take greater responsibility for your health care costs through a higher annual deductible. The annual deductibles for the Savings Plan are $4,000 for individual coverage and $8,000 for family coverage. After you meet your annual deductible, the Standard Plan pays 80% of the allowed amount for your covered medical and behavioral health benefits if you use network providers. You pay 20% of the allowed amount as coinsurance, which applies to your coinsurance maximum. The coinsurance maximum is the amount in coinsurance a subscriber must pay for covered benefits each year before they are no longer required to pay coinsurance. For the Standard Plan, it is $3,000 for individual coverage and $6,000 for family coverage for in-network services, and $6,000 for individual coverage and $12,000 for family coverage for out-of-network services. Under the savings plan, it is $3,000 for individual coverage or $6,000 for family coverage for in-network services and $6,000 for individual coverage or $12,000 for family coverage for out-of-network services. Please note that the coinsurance for in-network services does not apply to the out-of-network coinsurance maximum. The standard plan copayment for each visit to a professional provider's office is $15. There are no copayments under the savings plan. Until you meet your deductible, you pay the full allowed amount for services, which is applied to your annual deductible. The standard plan copayment for outpatient facility services, which includes outpatient hospital services other than emergency room visits and ambulatory surgical center services, is $115. This copayment is waived for dialysis services, partial hospitalization, inpatient, outpatient services, electroconvulsive therapy, and psychiatric medication management. The copayment for each emergency room visit is $193. This copayment is waived if you are admitted to the hospital. With the standard plan, you pay the full allowed amount until you meet your deductible for hospitalization. Then you pay your coinsurance. With the savings plan, you pay the full allowed amount until you meet your deductible. Then you pay your coinsurance. When you buy a prescription drug with the standard plan, you pay only the required copayment rather than paying the full allowed amount. With the savings plan, you pay the full allowed amount for prescription drug benefits until you reach your deductible. TRICARE is the Department of Defense health benefit program for the military community. Underwritten by the Hartford Life and Accident Insurance Company, the plan is administered by Selman & Company. The TRICARE Supplement Plan is secondary coverage to TRICARE. It pays the subscriber's share of covered medical expenses under the TRICARE Prime with no deductibles, coinsurance, or out-of-pocket expenses for covered services. Eligible individuals must be registered with the Defense Enrollment Eligibility Reporting System, or DEERS, and must not be eligible for Medicare. If the state health plan is your primary health insurance coverage, PIBA offers value-based benefits at no cost to you and network providers and pharmacies. These benefits can help make it easier for you and your family to stay healthy. Learn more about PIBA perks, including eligibility, at www.pibaperks.com. State health plan members enrolled in the standard plan or savings plan have access to Blue Care on Demand, a telehealth option offered through the state health plan's third-party administrator, Blue Cross. This platform focuses on live video visits through a computer or portable device and uses on-demand technology in which you can request a visit and connect with a provider in less than 2 minutes. Video visits are available 24/7, 365 days a year, and offer an affordable and more convenient alternative to emergency rooms and urgent care centers. State health plan subscribers who use tobacco or cover dependents who use tobacco will pay a $40 per month premium for employee-only coverage and $60 for other levels of coverage. The university and PIBA offer programs to help employees manage their mental health. The Employee Assistance Program, commonly referred to as EAP, is available to help employees and their family members through times of need. The EAP can help with a wide range of life situations such as family problems, including elder care, parenting, and marital difficulties, stress, depression, grief and loss, work-related concerns and balancing work and family, alcohol and drug abuse, preventative care, legal and financial care, crisis events and life skills, as well as resiliency and coping skills. Maru Health offers a 12-week treatment program at no cost to state health plan primary members to reduce anxiety, stress, depression, and burnout. It combines therapists and psychiatric support, a biofeedback training device, anonymous peer support, meditation practices, and habit-changing activities. Learn more about the program and enroll at maruhealth.com/CBA. Members can also take advantage of health coaching at no cost through Blue Cross. You have two options for dental coverage: Dental Plus or Basic Dental, formerly known as the State Dental Plan. You choose the plan that works best for you. When you make your election, you'll choose either Dental Plus or Basic Dental, not both. If you choose Dental Plus, we will automatically enroll you in both plans. There is a 2-year commitment for dental coverage. You may enroll in or drop dental only during the initial enrollment period in PIVA's insurance programs, or during open enrollment in odd-numbered years, or within 31 days of a special eligibility situation. Dental Plus has the higher allowed amounts, which are the maximum amounts allowed by the plan for a covered service. Network providers cannot charge you for the difference in their costs and the allowed amount. Basic Dental has lower allowed amounts, which are the maximum amounts allowed by the plan for a covered service. There is no network for Basic Dental, therefore providers can charge you for the difference in their costs and the allowed amount. The maximum yearly benefit for a person covered by Basic Dental is only $1,000 and compared to $2,000 with the Dental Plus plan. Under Basic Dental, not all dental procedures are covered. Dental coverage offers 4 classes of treatment. Class 1, diagnostic and preventative exams, cleaning and scaling of teeth, fluoride treatment, space maintainers, and x-rays. Class 2, basic fillings, extractions, oral surgery, endodontics, which are root canals, or periodontal procedures. Class 3, prosthodontics, crowns, bridges, dentures, implants, and the repair of prosthodontic appliances. Class 4, orthodontics. Orthodontics are limited to covered children ages 18 and younger. Correction of malocclusion consisting of diagnostic services and active treatment. PIVA offers vision care benefits through the State Vision Plan, a fully insured product provided through iMed Vision Care. The program covers comprehensive eye examinations, frames, lenses, and lens options, and contact lens services and materials. It also offers discounts on additional pairs of eyeglasses and conventional contact lenses. A discount of 15% on the retail price and 5% on a promotional price is offered on LASIK and PRK vision correction through the U.S. Laser Network. Medical treatment of your eyes, such as eye diseases or surgery, is also covered by your health plan. Your monthly premiums for health, dental, and vision are available on the insurance benefits page of sc.edu, as well as piva.sc.gov/monthly-premiums. PIVA's life insurance program is underwritten by Metropolitan Life Insurance Company, or MetLife. The insurance offered is term life insurance, which means coverage is provided for a specific period of time. The policy has no cash value. Automatic enrollment into the basic life insurance benefit, including accidental death and dismemberment coverage, is provided to eligible employees enrolled in the state health plan or the TRICARE supplemental plan. There are no specific forms to complete to participate, and you receive this benefit at no cost. Basic life insurance coverage provides $3,000 in term life insurance coverage to eligible employees age 69 and younger, and $1,500 to eligible employees age 70 or older. The accidental death and dismemberment coverage amounts are the same as the basic life insurance. For many people, purchasing additional life insurance over and above employer-provided coverage can help lend greater financial security. The optional life insurance benefit with accidental death and dismemberment coverage is a voluntary benefit in which you pay the entire premium with no contributions from PIVA or your employer. If you are an eligible employee, you can enroll in optional life insurance within 31 days of the date you are hired. You can elect coverage in $10,000 increments up to 3 times your basic annual earnings, or up to $500,000, whichever is less, without providing medical evidence. You can apply for a higher benefit level in increments of $10,000 up to a maximum of $500,000 by completing an electronic statement of health form to provide medical evidence. As a new hire, you can enroll your spouse for only $10,000 or $20,000 in dependent life spouse insurance. Medical evidence is required for all coverage amounts greater than $20,000. Coverage amount increases of more than $20,000 and for coverage not elected when your spouse became first eligible or due to a special eligibility situation. Your spouse's coverage will be reduced at ages 70, 75, and 80 based on their age. Spouses enrolled in dependent life coverage are also covered for accidental death and dismemberment benefits. They are eligible for the seatbelt benefit, airbag benefit, child care benefit, and child education benefit. The dependent life child benefit is $15,000 per child, and coverage is guaranteed. Children are eligible from live birth to ages 19 or 25 if a full-time student. A child can be covered by only one parent under this plan. The premium is $1.26 per month, regardless of the number of children covered. Eligible children may be added at initial enrollment and throughout the year without providing any medical evidence. Unexpected events can always occur, and many people think they will never become disabled. Long-term disability coverage is available to eligible employees. Standard Insurance Company administers disability coverage. This benefit is only available to active employees. Employees are eligible for basic long-term disability if you are covered under the state health plan or the TRICARE supplemental plan. Supplemental long-term disability insurance, or SLTD, is fully insured by Standard Insurance Company. It is designed to provide additional financial assistance beyond the basic long-term disability plan if you become disabled. You may choose a 90-day or 180-day benefit waiting period, and you may change from a 90-day to a 180-day benefit waiting period. The benefit waiting period is the length of time you must be disabled before benefits are payable. MoneyPlus allows you to save money on eligible medical and dependent care costs. Because MoneyPlus is governed by the Internal Revenue Code, Internal Revenue Service requirements and restrictions exist for program participants. The pre-tax group insurance premium feature allows you to pay your premiums with pre-tax money, and there is no administrative fee. A medical spending account, or MSA, allows you to pay eligible medical expenses not covered by insurance, including co-payments and co-insurance with pre-tax income. MSAs offer the ASI Flex Card, which functions like a debit card. You can use this card to spend funds as an alternative to submitting claims for reimbursement. You can carry over up to $680 of funds placed in your MSA that you did not use during the plan year into the next plan year. You will forfeit funds over $680 left in your account after the reimbursement deadline. A dependent care spending account allows you to pay work-related dependent care expenses with pre-tax income. This account is only for daycare costs for children and dependent adults and cannot be used for dependent medical care. The funds can be used only for expenses incurred during the current plan year. State Health Plan Savings Plan members are encouraged to participate in a Health Savings Account, or HSA. An HSA is a tax-favored account that offers several advantages for saving for future healthcare expenses and even retirement. HSAs carry over from year to year, and you do not have to spend the funds in the year they are deposited. If you are making contributions to a health savings account, you also may be eligible for a limited use medical spending account, or LMSA. This account may be used for dental and vision care expenses only. The People Insurance Benefits Enrollment process is a two-step process. In the HCM PeopleSoft system, eligible employees may refuse or enroll in state insurance benefits within 31 days of their date of hire. Enrollment into insurance benefits or refusal of insurance benefits is initiated through the university's HR payroll system and employee self-service. You will receive an email notification to get you started. Click on the link to access the benefits e-form, then enter your USC username and password to log into PeopleSoft. If you are unable to locate the enrollment link, please check your spam and junk folders. If you do not complete enrollment documentation within 31 days of your hire, you will miss your opportunity for initial enrollment. Your next opportunity to enroll in core benefits administered by PEBA will be during the October 1st to 31st open enrollment period or due to a qualifying life event, whichever recurs first. After this initial enrollment, your insurance benefits will be managed and renewed using PEBA's My Benefits online enrollment system. Follow these instructions to set up a new My Benefits account. Once you complete the benefits e-form, you will receive an email from PEBA to approve and sign your benefits enrollment in PEBA's online system, My Benefits. To register for My Benefits, you will need the following: your benefits identification number, the last 4 digits of your social security number, and your date of birth. To supplement state coverage, there are supplemental insurance benefits administered by Ward Services. USC offers universal life, long-term care benefits, as well as short-term disability, critical illness, accident, auto, and home insurance. Universal life and long-term care insurance is a universal life benefit in which the premiums are locked in at the purchase age. It includes a long-term care benefit, which is 4% of the death benefits per month. It is available for employees, spouses, children, and grandchildren. Short-term disability insurance is paycheck protection that pays if a policyholder is out on disability for sickness or injury. The policy consists of a 90-day benefit with a 14-day elimination period. The benefit can be up to 60% of the employee's normal pay. It is available to employees only. With critical illness and cancer insurance, you will receive a lump sum benefit of $5,000 to $30,000 for a critical illness diagnosis, which is heart attack, stroke, cancer, and 28 other illnesses. It is available for employees as well as spouses. Accident insurance pays a benefit in the event of an accident based on a schedule of different events and treatments. It is available for employees, employee and spouse, employee and children, or full family. Employees have from 30 days of their date of hire to enroll in the supplemental benefits. The University of South Carolina partners with Ward Services, a third-party enrollment vendor, to offer a personalized enrollment experience. Schedule a one-on-one, virtual, or in-person on-campus meeting with a Ward Services benefits representative to learn more, ask questions, and get assistance enrolling in these benefits. For online scheduling support, call 844-533-2022. Once your appointment is scheduled, you will receive a confirmation and reminder email from Appointment Plus. If you do not receive these emails, please check your junk email. If you do not complete enrollment within 30 days of your hire date, you will miss your opportunity for initial enrollment. Your next opportunity to enroll in the supplemental benefits will be during the Ward Services open enrollment period. It is administered by Travelers Insurance Company and available to employees and members of their household. The premium may be payroll deducted, or you may elect to have monthly withdrawals from a checking or savings account for the auto and home insurance. For university life and long-term care insurance and critical illness, and cancer insurance, visit the Trustmark website for more information. For short-term disability and accident insurance, visit the Colonial Life website for more information. For auto and home insurance, visit the Travelers website for more information or call 800-842-5936 for a free quote. Retirement benefits. PEBA administers 2 types of retirement plans, a defined benefit plan as well as a defined contribution plan. A defined benefit plan provides for a traditional fixed annuity at retirement. Upon retirement, a member is entitled to a monthly annuity for life. It is calculated using a predetermined formula that includes years of service, the member's compensation, and a benefit multiplier. A member's monthly annuity is not limited to or contingent upon the member's account balance, which includes the member's contributions and the interest earned on those contributions. The South Carolina Retirement System, or SCRS, and the Police Officer Retirement System, or PORS, are 401A defined benefit plans. The university remits an employer contribution to SCRS. This employer contribution rate is set by law as a percentage of earnable compensation for covered employees. Employer contributions are not credited to individual member accounts. A defined contribution plan provides for an individual account for each participant. Benefits are based on the balance in a participant's account rather than a fixed annuity. The State Optional Retirement Program and South Carolina Deferred Compensation Program, which are 401k and 457 plans, are defined contribution plans. The university remits an employer contribution to your account with your service provider equal to 5% of your earnable compensation. You immediately vest in the 5% employer contribution, which means those contributions immediately belong to you. For the current fiscal year, SCRS members and state ORP participants contribute a tax-deferred 9% of earnable compensation into their retirement account. PORS members contribute a tax-deferred 9.75% of earnable compensation into their retirement account. To elect one of the PEBA administered plans, you will receive an email from PEBA Retirement. Employees eligible to participate in SCRS or the state ORP may select the retirement plan that best meets their needs within 30 days of hire, or if eligible, elect non-membership or PORS. If you do not respond to the email from PEBA to make your retirement selection within 30 days of your initial date of hire, you will default into the SCRS plan or the PORS plan if applicable, and this is an irrevocable default. Member Access is the online resource that allows you to view and update the personal information on file for your retirement account. To register for Member Access, you will need the following: your last name, social security number, date of birth, and a valid email address. Please see the Member Access flyer for more details on how to register. A very important reminder is you are responsible for your benefits. Enrollment in these benefits is not automatic. You must make elections within 30 days of your official hire date for retirement and 31 days for insurance or special eligibility situations. For more information about special eligibility events, please visit PEBA's website at peba.sc.gov. To initiate your enrollment, complete your insurance benefits e-form in PeopleSoft. If you're not enrolling in coverage, you must affirmatively refuse all coverage as well. For detailed information about benefits, visit the PEBA or USC website at sc.edu. For any questions about your benefits, please contact us at benefits@mailbox.sc.edu. For additional information, you may visit Human Resources of USC at sc.edu and click on Benefits. You may also visit PEBA's website at peba.sc.gov. You may contact your campus HR office for assistance. For the Columbia campus, please call 803-777-6650. You may also call PEBA at 803-737-6800 or 888-260-9430. To help diversify your financial portfolio to help you become retirement ready, the university offers supplemental retirement benefits. There are several different types of voluntary retirement plans. The South Carolina Deferred Compensation Program offers a unique opportunity for you to save for your future. It is a straightforward way to work toward the retirement income you desire. Empower Retirement is the current administrator of deferred comp contributions, which are payroll deducted. You can contribute to a 401k and a 457b plan and elect to contribute before tax or choose the Roth option to make after-tax deductions. Visit www.southcarolinadcp.com to learn more about deferred comp and to enroll. You can also call Empower Retirement at 877-457-6263 or visit the local office in Columbia, South Carolina. The local office is located at 200 Arbor Lake Drive, Suite 201, Columbia, South Carolina 29223. Their office hours are Monday through Friday, 8:30 a.m. to 5 p.m. The 403B program is a tax-sheltered annuity plan sponsored by the University of South Carolina and has 3 providers, TIAA, Corebridge, and Fidelity. They all can assist you in meeting your individual retirement goals. Contributions can be made as pre-tax, after-tax Roth, or both. Log into the Retirement at Work portal with your USC username and password to enroll in your University of South Carolina 403B plan. Through the Retirement at Work portal, you can also change your voluntary contribution amount at any time. You can choose your preferred retirement plan providers. You can view your retirement plan balances across all the plans and investment providers, as well as access tools and resources for planning. Refer to the Retirement at Work Quick Start Guide to log into the portal. Whether you are sick or planning a family vacation, USC offers generous leave benefits to help our employees maintain a healthy balance between work and home life. Each type of leave has unique eligibility requirements, accrual rates, and procedures. For more details, please refer to the individual leave policies. USC observes the same number of holidays as other state agencies, even though the days on which the holidays are observed may differ because of the academic schedule. When a university holiday falls on a Saturday or Sunday, the holiday will be observed on the preceding Friday or the following Monday. Employees who are in a paid status 1/2 or more of the working days of the month will be credited with annual leave earnings for the full month. Employees in a pay status for less than 1/2 of the work days of the month will not earn annual leave for that month. Faculty on less than a 12-month basis are not eligible to accrue or use annual leave. Employees will continue to accrue annual leave while out of work on sick leave, annual leave, or other authorized leave with pay. Employees will not accrue annual leave during periods of unpaid leave that exceed 1/2 or more of the working days in the month. Faculty on a 12-month basis will not earn annual leave during periods of sabbatical leave. University faculty should refer to the appropriate faculty manual for additional details. Employees' annual leave earnings are computed based on the following: the number of hours in the employee's average workday, the employee's state service date. Employees who are in a paid status for 1/2 or more of the workdays of the month shall accrue sick leave for the full month. Employees in paid status for less than 1/2 of the workdays of the month will not earn sick leave for that month. Employees will earn sick leave while on sick leave, annual leave, or other authorized leave with pay. Employees' sick leave earnings are computed based on the number of hours in the employee's workday. All employees in sick leave earning positions shall earn sick leave beginning with the date of employment at the rate of 1.25 workdays per month of service, or 15 days per year. To determine the number of hours in a workday, divide the total number of hours an employee is regularly scheduled to work during a week by 5, regardless of the number of days the employee actually reported to work. Please scan the QR code to review the appropriate employee job aids to submit leave. Once you have reviewed the appropriate job aid, log into the Time and Absence system and click on the Time and Absence tile to start the process. For most leave questions, please contact us at hrleave@mailbox.sc.edu. For workers' compensation questions, please contact us at workerscomp at mailbox.sc.edu. For more information, you may review the time away from work and time, labor, and absence management in HCM PeopleSoft on HRA website. You may also have an option to call us at 803-777-6650. Thank you for watching this introduction to new employee benefits.